Welcome to a new episode of Science in Context. This week, we share a sneak peek behind the scenes of the Bridging the Gap Hackathon in Nairobi, Kenya, with insights from the organizers and experts. Jeanette, can you explain what the key motivation was to organize this hackathon?
So we organized this hackathon so that we could bring together policymakers, tech developers, people with quantitative skills just into one space. So working together, they can build open source resources that can help in evidence-based decision making.
Paula, welcome. Can you explain what your key take-home messages are from the past 5 days of hackathon?
This hackathon showed that such a format does facilitate or can facilitate a dialogue between policymakers and scientists and software engineers. And I think this very unique format showed that we can facilitate understanding each other and learning from each other in the context of strengthening healthcare systems and health interventions through mathematical modeling, advanced analytics, and software development.
Mumbua, welcome. Why is this work so important from a policy perspective?
It's important because as a mandate from the DVS, we are working towards providing animal health as well as human health. And from the work we've been doing with CEMA, working on our dashboard, this will help us visualize animal health surveillance data, and this will help provide evidence-based policies that will help inform in disease control and prevention interventions.
Motiri, welcome.
Thank you.
Can you explain from a health workforce perspective why this work is so important?
So from the health workforce perspective, we realized that we have a lot of challenges in terms of distribution of health workers in the country, because most of the health workers tend to work or prefer to work in urban areas. So having a recruitment model which informs the distribution of health workers will enable us as the policymakers to have evidence in how to distribute these health workers and to serve the population health needs.
Thank you so much for your time.
Thank you.